and welcome to this Blackpool Teaching Hospital's ultrasound video lecture. My name's Simon Hayward, and this video is a recording of the presentation that I did at the Virtual Physiotherapy UK conference on the 13th of November 2020 in collaboration with the ACPRC. So I've re-recorded this so that those individuals that couldn't make the presentation at the conference on the day have access to the same information. So on the screen you've got a QR code for some additional information in the form of a PDF. So by all means use a QR scanner or your camera phone to take a picture of this, and it should link you directly to the document on the ACPRC's website. If not, then I will attach a link in the description below that sends you to the document as well. So to begin with, the first question is, why do you need a mentor? So most of the training programs that you do in the UK, you need to have an established and identified mentor. This is part of the requirement of the course. And if you're going to be learning a skill such as lung ultrasound or any ultrasound, to be honest, then you're going to need to have that direct or indirect supervisor support. Particularly when you're first starting off, in the vPUK training program, you particularly need a mentor for the first 10 scans because they will directly supervise your scans. And then beyond that, you need the mentor to be able to look at your unsupervised scans and give you feedback on those. You will also need a mentor as you get to your accreditation with regards to doing either a triggered assessment or a viva, for them to get you through that practical exam. And then beyond your accreditation, it's always good to have an additional member of staff that can support your continued learning, because by no means, once you're accredited in any of these point of care ultrasound techniques, lung or otherwise, are you deemed to be an expert. You have a continuing journey of experience and continued professional development. So within the UK, there are a few lung or thoracic ultrasound programs that you can access. The most established one is the Royal College of Radiologists Thoracic Ultrasound. The introductory is obviously level 1, and there is level 2 as well. You then have the Focus Ultrasound Intensive Care, or FUSIC as it's abbreviated to. That's from the Intensive Care Society, and that's the program that I teach and I follow. Acute Medicine have their version as well, so Focused Acute Medicine Ultrasound. Pediatrics have the Children's Acute Ultrasound. And then most recently, Emergency Medicine have their Focused Emergency Medicine Ultrasound. So a lot of these programs are quite similar, but depending on the speciality area that you work in, you could potentially choose the one that is most relevant to your area. But ultimately, if you have access to another training program in your hospital or where you work that isn't directly related to your clinical area, these programs, like I said, are very similar, so it shouldn't matter too much. So finding a registered mentors, they can be a little bit tricky, as there are definitely more mentors out there that aren't necessarily registered as mentors themselves. So they have the experience, but they haven't actually added their names to the mentor lists that are available to search through. So FUSIC and Famous on their websites do have a searchable database, either by name, postcode, or location usually. But the others, at the point of recording this, hadn't established a searchable database. So depending on where you work, you might need to make inquiries and ask around as to who could support your training moving forwards. Now, in the training programs, like I said, some of them are quite similar, and at the very least, the experience that a potential mentor has in one discipline, say intensive care, that does stand them in very good stead to be able to be a mentor for the other programs as well. So it was just a case of inquiring about whether a particular mentor from a different training program could apply for the mentorship for the training program that you're doing, or, as I said previously, alternatively, you do the different training program because of the similarity. But with one particular mentor, you could ask them to join another program, get mentor status with that, and in actual fact, you could end up with individuals that could potentially mentor trainees through all of these different programs because they have the relevant experience and they have applied and been approved to be a mentor for all the programs. Usually, the ability or the process of applying for mentor status comes at no other extra cost. It's a case of filling out a certain amount of information and showing that you're competent to be a mentor and the experience that you have. So how do you go about finding potential mentors if they're not registered on a database or there isn't one in your local place of employment or hospital? So you may be able to identify or already know that there are certain individuals who seem to be very experienced in lung ultrasound or other ultrasound techniques. They've been using it for a long time. They may or may not have classic accreditation evidence, but it's been such a big part of their practice over a number of years that they have shown a high degree of competency. So you may be able to approach them and ask them to potentially become a mentor. Usually that again involves them explaining their years of experience, the number of scans they do, any training they have accessed. But hopefully those individuals, if they can show that competency, could be able to get access the approved mentor status through the training program that you're hoping to follow. The other option is that you're aware of or find out that somebody within your hospital or workplace has previously done the training program, perhaps a year or 2 years ago, and since then they've been using it regularly within their clinical practice and therefore do have enough experience to actually gain mentor status themselves. So they're previously accredited, never applied to be a mentor, never even thought about it, but they do have the skills and competency to go through that process. So you could encourage them to apply for mentor status, and then hopefully they'll be able to help you out. So what are some of the places that you could actually look to find potential mentors? So you're going to have a huge variety of specialities and professions that might be able to support you. Until you make inquiries, you're not too sure who may or may not be able to support your journey into lung ultrasound. So I would encourage inquiries through anaesthesia, intensive care medicine and emergency medicine. There are some very competent clinicians out there who've been doing this for years, but haven't really got to the point where they're supporting others. This could be the beginning of that journey for them if they have the skills and the capacity to support others. Look into acute medicine, respiratory medicine with the respiratory physicians. They've probably been using ultrasound in plural clinics for a long time. Inquire with radiology as well. So you may well find that individuals might not have the specific lung ultrasound skills that you require for them to be a mentor, but they are again a huge source of information and experience with regards to general ultrasound utility and management and processes. So definitely approach them and ask for some degree of support or mentorship if they can provide that. And then within the acute, so advanced clinical practice and advanced critical care practitioner professions, you may find that there are some individuals that have previously been nurses or ODPs or even physiotherapists that have gone into those advanced clinical practice roles that have the skills necessary to support you. And more, particularly relevant to me and my background, is that we are beginning to build up a network of physiotherapists working in respiratory areas that are able to mentor other individuals and physios from within the profession. So you may be looking for one mentor, but you secure that individual, but they don't have a huge amount of capacity to help you through the whole training program. Or potentially they leave, they can't work for whatever reason, or they can't give you the support. So you can have multiple mentors. It may well be that they don't have the work capacity to support you, so you can share that with somebody else. Now that second individual doesn't necessarily have to be at the same place of work. So if the initial mentor can support you through your supervised scans, then you may well find that when you get to your unsupervised scans, you can start to get supervision from an individual that isn't in your locality and therefore have remote mentoring. So there are various ways that this can be done, but suffice to say that you can actually use individuals that aren't local to you to support your continued learning, particularly if the first individual can't continue for whatever reason. When you do get to your unsupervised scans, and if you are thinking of using a mentor that isn't directly accessible to you, and you have to do it remotely, there are plenty of opportunities to do this, but it does need consideration with regards to patients' confidentiality, particularly when sharing the scan or the scan clips with that individual for them to review on your behalf. Websites like Hocus Pocus and SonoClipShare have the opportunity to remove identifying information and anonymize the clips. So it is one potential route is to perhaps use those systems. And then the one that is particularly within the UK and further afield is the hospital's imaging exchange portal. So this is the system that medical profession, radiology, radiologists would use to send images over longer distances for second opinions, or when patients move from hospital or care provider to different care providers. So you could potentially get access to those systems and share your images in that way. One other thing you can do is try and get everything organized and then just bide your time. Get all the permissions that you need eventually, but also just wait until a natural turnover in staff has allowed an individual to come into your place of work that then happens to have the skills to become a mentor for you. Particularly the medical trainees, they move around quite a bit as part of their training program. So there are some very experienced trainees out there who have these skills, and it's just a case of waiting for one of those individuals to come into your place of work and be able to take that responsibility to support your learning. Alternatively, if somebody recently has gained their accreditation, then 12 months later, usually, with regular practice in the clinical environment, then they should be able to apply for mentor status themselves. So they may well be able to gain the accreditation, get the clinical experience, and show sufficient competency to be approved to be a mentor, and then that individual could potentially become your mentor as well. So what is coming soon at Blackpool Teaching Hospitals for physiotherapists only at this stage? I'm planning to set up a 5-day intensive lung ultrasound training. So that involves the introductory course on day 1, and then 4 days of intensive scanning to work through the requirements for the vPUK training program. It will only be open to very experienced clinicians, not necessarily senior ones, but definitely experienced respiratory physiotherapists who are able to absorb and cognitively take in the huge amount of information that's going to need to be given during those 5 days, because that will be quite an intensive process. With the advent of a lot more remote video calling in the current situation we find ourselves in. There may well be the opportunity to do virtual remote mentoring as well. So it's not beyond the realms of possibility that actually people using cameras and headsets to potentially get that supervised scanning, but done remotely from a different location to get through their training. If you have any questions, don't hesitate to contact me either via the email on the screen now. You can also contact me through Twitter. I now have a Blackpool Teaching Hospital Ultrasound YouTube channel, which some of you may be watching this on at the moment. And also on Facebook, you can search for the Physiotherapy Lung Ultrasound interest group. Please don't forget to subscribe to the channel and click the notification bell so you don't miss out on any future videos. And do check out some of the other video content on the channel as well.